To tell us is the one and the only Dr. Thomas Dobbs, who is the state health officer, who has been one of the key and most visible people during this. And the stock in Dr. Dobbs has been incredible. He's been on the air with us many times, but we've gotten to know him now in a way that we didn't before. And we wished we didn't, but we're glad he was there. Dr. Dobbs, good morning, sir. How are you?
Yeah, good morning. Thanks for having me again.
You had no idea this was going to happen several years ago, or even several months ago, to be honest with you. And it's a whole new ball game out there. But what is it? I guess it was something that you guys talked about as a possible case. There were some who consider this a real viability and knew it was one of these things where it's not going to be if, it's going to be when. But there was always talk about this.
We've had several things come up, and really because of our historical precedent, really expected more of another pandemic flu, maybe something similar or worse than the 2009 experience. Looking at something that's more deadly, kind of like the H5N1 sort of scenario. Coronavirus is a new thing to do this way, and so although there's a lot of similarities with pandemic influenza, there's a lot of differences, especially the fact that no one has any underlying immunity. It just makes it that much more challenging. It's a remarkable time in history.
I think if you were looking for things that were frightening, I don't remember anything other than polio, of course, early on in the baby boomers' lives. But if you want to talk about something scary, the more you read about Ebola. Now, that was something, if this were Ebola, you talking about scary, that was a scary, scary period of time there.
Yes, sir. Absolutely. I mean, we certainly got pretty worked up about it. But in a way, this is more insidious because it kind of just slips in and kind of goes under the radar until it starts popping up and killing people. And that's one of the things that's just really so maddening about this is how it sort of kind of slips into our daily lives, and it's going to be with us for a while, which is another thing that's really kind of hard to accommodate to.
One of the things that I mentioned in the last couple of days is the more information we get this, and I read a lot of information on this on a daily basis, and the more we get, the more information we get, the more we know about this virus that we didn't know. And I always issue a little bit of a disclaimer and just to let people know if there are changes. A perfect example is the mask. It's not because they made a mistake. It's just because we've learned more and more about this at a rapid clip now. Thank God for social media and data mining and all of that. So as we move on, we learn more about it. We change to meet that. And it's not so much that the edicts that were put in place early on were not needed or were wrong. It's just that we learn things and we accommodate those things. Am I right?
Absolutely. We're learning so much as we go through this. And thank you for mentioning the mask piece, because as we try to get back to some semblance of normalcy, we really do need to do these things that allow us to do essential, around the town sort of stuff, but also to protect ourselves and others. The mask is a great thing. It's a simple, safe, useful component to being careful in the community, because this thing is not over. We're still, clocking, almost 200 cases a day. We'll have a good bit more cases reported later today, and we're still seeing significant hospitalizations. And actually, today we'll report increased number of patients hospitalized with COVID and increased ICU and ventilator numbers. The system's not stressed, but just this thing is not far. It's far from being over.
Well, is there any trend now that you can confirm that we haven't reached the peak yet, or we are reaching another peak? Is there any confirmation as far as any trends are concerned?
Well, we don't know about the peak. The peak was confirmed. Was predicted for last week, and it takes us about a week to 10 days to really look backward in time to see when the cases were transmitted. So it's going to take us a little while, but clearly, at a minimum, our peak was not like 2 weeks ago, right? So we're seeing the maximum number of new cases occurring last week so far. Not that it couldn't continue. If we look at hospitalizations and deaths, not surprisingly, that's going to lag a week or two behind getting sick, because it takes you a while to get in the hospital. And then, when folks get really sick, we really try to give them the medical care that they need. It takes a while for them to then go on and die, unfortunately. So there'll be a delay in those measures.
Would you see, in your research, have you seen where the ventilators have been helpful or harmful?
Oh gosh, they're so helpful. I know there's been some strange stuff out there about the ventilators, but the people get a pretty it's a different disease. There's no doubt about it, but a lot of it is a thing called ARDS that we're very familiar with as a severe lung injury. And if you give proper supportive care, gently nudge the lungs back into normal function, you can have a really good chance of recovery if you get that sort of tender love and care that it takes to let someone get better.
What's the very latest as far as your assessment of hydrochloroquine?
It's been up and down for hydroxychloroquine. There were some early evidence of some efficacy against the virus, but also, there's some dangers to it right now. So I'm very comfortable with the scientific community's assessment that there could be a use for it, but it needs to be carefully administered in a hospital setting and under under a clinical trial. And fortunately, here at our own University Medical Center in Jackson, they're doing clinical trials not only of hydroxychloroquine but also plasma therapy and remdesivir. So docs, or if patients are in the hospital and need an experimental therapy, there's access to it at UMC.
Where are we on testing now? Is the caseload gone down or up at the Trade Mart and other places in the state? Are we still testing as many people?
As a whole state, we're still testing more people. Some of the demand has dropped off a little bit as far as symptomatic cases. Of course, that's variable in different regions. We've seen increased case counts in places like Scott and Leake County, and so we'll certainly need to do additional testing in those areas. There's been less demand of the state lab, and so it's hard to know exactly what that means because we've ramped up capacity for the private labs. There's more availability of sort of rapid tests in the hospitals and other areas. So there's offloading of the public system, so that gives us an opportunity to do the public health functions as surveillance and going out into the community. But I'll just have to sing the praises of the private medical community. The docs, the community health centers have done a fantastic job taking care of Mississippi's population, and that's why we're one of the leaders in the state. Our lab's done a great job, but it's really the frontline healthcare system that's done the best job getting those tests done.
Perez, are you there? Did I drop out?
No, you're okay.
I'm okay. Did he drop out?
Oh, I'm here. Can y'all hear me?
Okay. Yeah, I hear you now. Go ahead.
Sorry about that.
You were saying about the testing. I was going to ask you also: Are we still using one different type test, or one type of test, or are there new tests on the horizon?
Yeah, so we're still depending upon the what we call the PCR test. It checks for the genetic material, and that's the test you can use to assess if someone is actively ill, like if they have the infection currently, and are they contagious. And so that's the most important test. There's a new test that's becoming more and more available called a serology test, or basically it tests for the antibodies or the immune response. There is some usefulness to that test. It tells you if you had an infection before, but it doesn't usually tell you if you're sick right now. So it doesn't have much implications for that. But there's a lot of the performance of the test is looking kind of spotty, so we're kind of watching that closely.
Let me ask you about the antibody test, because I know a lot of states are talking about the percentage of people who have had total cases versus how many deaths from that, putting a percentage on there. We've had 6,094 cases that we have confirmed. We have total deaths at 229, so then you extrapolate exactly what the percentage of people and how deadly this virus is. I think every state now with the antibodies are understanding, and the case in point was California and subsequently New York. Then they find out that literally tens of thousands of other people may have had this disease prior and have built up some immunity, or at least they're still living, breathing, so the percentage of the death goes down tremendously. How are we going to figure out who to test with the antibody test when we start going with that?
So there'll be multiple reasons to do it, but for the purpose that you mentioned of finding out what percentage of Mississippians are infected, we're evaluating which tests we would want to use and what deployment we would want to institute to make that happen. What they've done in New York is they sample people like at a grocery store or something like that, just to kind of get a random sample. So something of that nature we would like to do. Still some caution about the serology test because there's other coronaviruses that people get that cause kind of a common cold sort of stuff, and we're worried that there might be some false positives.
Some mixed up on that one, yeah. Look, it's always good talking to you. I appreciate it so very much. I wish we had more time, Dr. Thomas Dobbs, but you're saying that today when you release the information, we're probably going to see a little bit of an uptick, which is concerning. We want to get you back again. Dr. Thomas Dobbs, thank you, sir. Final segment is